To observe this 63-year-old grandmother, you'd never know she has incontinence.
It's almost like gravity pulling. I have to go to the bathroom, and when I have to go, I have to go. And I might not be in the right place, so you have accidents.
There are two main types of incontinence.
One is stress incontinence, which is usually the leakage with coughing, laughing, sneezing, jumping, lifting, stepping up a curb, which is usually due to either your lack of support to the urethra, which is the tube that connects the bladder to the outside, or just a very weak sphincter muscle. Come on this way and we'll get the nurses take your vital signs.
The other is urge incontinence that can occur with overactive bladder, or OAB. It's the type Nancy has.
An overactive bladder or urge incontinence is usually that people have a normal urethra and often normal anatomy, but the bladder muscle contracts when they don't want it to. Well, how's your bladder adapting with all the travel?
My bladder sometimes cooperates and sometimes it doesn't cooperate.
Overactive bladder is a medical problem, and it can be treated.
A lot of patients will come in and say, gosh, I had no idea. I thought it was just a normal part of aging. And then somebody told me that it wasn't and that there was something I could do.
Dr. Wiskin advises women to start with behavioral or lifestyle changes that include timed voids, that is, scheduling regular bathroom trips, cutting down on caffeinated beverages and alcohol, limiting spicy and acidic foods, and doing regular pelvic floor exercises or Kegels. Once behavioral changes have been adopted, medications can be very effective.
This medication is to treat an overactive bladder, acts as like a smooth muscle relaxer.
These medications are known as anticholinergics.
The bladder muscle wall is full of cholinergic fibers, so these try to help the bladder muscle wall relax and not be so spastic.
There are many anticholinergic medications available. How do you know which option is best?
You don't. We really end up just sort of going down the line and figure out which one works. There's so many different studies out there, and they really show that they all work about the same.
Doctors may also prescribe tricyclic antidepressants or antidiuretics. If lifestyle changes and medications don't help, other treatments such as electrical stimulation and surgery may be recommended.
Is the medication okay?
Nancy has made the behavioral changes suggested by her doctor and takes medication. She's also found other ways to live with OAB. To avoid the pull of gravity, she avoids long walks and may relax with a book if she knows she'll have a night out.
Just don't let it stop you from doing what you want to do.
There's lots of options and lots of things we can do. And sometimes it's very, very simple things that can be done that can really improve the quality of life.
For WebMD, I'm Rhonda Rowland.